On that video 3, we will see how to correct a nose deviation by drawing the aesthetic lines. We plan to inject laterally 0.2 or 0.3 ml of the cohesive gel. Then we will correct and hide the hump on the dorsum by injecting 0.2 cc on the naso-frontal angle, and then to correct the supratip depression with 0.1 or 0.2 cc. But first, we may start with the Eiffel Tower concept by lifting the tip with a columellar strut with a thick volumizer HA gel to obtain a tip rotation. At the end, we will have a tip refinement with 2 light projections. That will be my entry point, 1, 2, 3, and 4, to safely inject the nose on an area where we have less vessels and not big vessels. The facial artery runs under the nasolabial fold and then on lateral part of the nose by ending with the angular artery and giving some branches on the nose and the nostrils. The main danger is at the upper part of the nasolabial fold. So if we stay medial, we minimize the risk of problems. Have a look at where we want to deposit the gel, always medially, away from the big vessels. And the pyramid, the Eiffel Tower, will be safer injected on the columella, away from the vessels. We usually start by the injection deep on the nasal spine to lift the tip. And then we will inject the naso-frontal angle down to the bone. The injection is medial with a slow anterograde and retrograde injection down to the nasal spine. The lidocaine, if you inject slow, has time to numb the area. Then, with the same entry point, we bend the needle on the sterile cup and we inject on the columella to create like a cartilage graft with this volumizer HA gel. As the injection is medial, it's safe, and we obtain a good tip support and a tip rotation. The second step is then to correct the naso-frontal angle to hide the hump. Again, a medial injection is safer. Same safe injection to inject on the supratip to hide the lower part of the bump with 0.2 cc of the same HA gel. To correct the concavity on the left side, we use a lateral injection, more superficial, subdermal, to recreate the aesthetic line on the left side, and you see easily on the right side the projection. That's the immediate final result with a good correction on the hump and a good tip projection. That is the project on a morphing system on a 3D camera. We propose the patient to accept the project because it's not a hump removal but a hump hiding with the gel, and then we can compare the final result, immediate final result on the same 3D camera, natural shape of the nose and a straight nose on the front view for patient satisfaction.